Hi, for those of you new to this channel, my name is Dan Johnson. I spent 15 years at Boeing and Amazon doing everything I was taught. I picked up extra projects, worked weekends, and I maxed out my 401k to make sure I'd have enough money in retirement. Then about 3 years ago, I turned 40 and found my career and income growth were starting to stall. So I decided it was time to get serious about my financial retirement plan and sat down with an advisor. I expected to be told I was going to have the opportunity to retire early, considering how much money I had been stocking away over the years. But instead, what I was told was the exact opposite. To obtain the retirement I valued, I was told I had three options. One, work longer and hope I was healthy enough in retirement to live the way I wanted. Two, save more and sacrifice even more of my lifestyle today. Or three, lower my expectations, which really meant retiring where the cost of living was lower, away from the friends and family I built relationships with over decades, and who are the exact people I wanted to spend more time with by retiring. I refused to accept those options, and what I've discovered changed everything. And now I'm on a mission to educate my fellow corporate Americans about the financial options available to you so you can generate the maximum amount of retirement income using the least amount of dollars. Over the past few weeks, I've posted videos talking about why the tax rate you pay in retirement may just be higher than what you're paying today. We've looked at historical tax rates, the federal debt, and even Social Security. I'll include links to those videos below. Today, however, we look at another uncomfortable truth: Medicare and Medicaid. The truth is, those of us in corporate America don't hear about the impact Medicare and Medicaid truly will have on our retirement plan until it's too late to make changes. Because it isn't easy for an HR department or financial advisor to explain those benefits or how changes to the government could impact them, compared to how saving for a 401k will impact our retirement. Both programs launched in 1966, originally just meant to be a supplement plan for private health insurance, not something to replace it. Back then, the services covered about 23 million people, cost just over $4 billion, and made up about 3% of the federal budget. Today, those same services cover more than 140 million people, cost over $1.85 trillion, and accounts for more than 20% of the federal budget. Honestly, inflation has also increased significantly since 1966. However, spending on these programs has grown roughly 50 times faster than inflation. And here's the part that should really bother you. The federal income tax rates that help fund Medicaid are actually lower today than they were in 1966 for an equivalent income. And that's despite the fact the workforce paying into these programs relative to the number of people receiving benefits from them is shrinking significantly, as baby boomers are retiring in record numbers and living longer than the generations before them in retirement. So what does this mean? For Medicare, which operates much like Social Security and receives funding from payroll taxes, it means independent studies are estimating the trust will run out of funds by 2036. Meanwhile, is funded straight out of the general tax revenue. And by law, it can never technically run out of money, which sounds reassuring until you realize what that actually means. The risk isn't that Medicaid collapses, it's that it keeps consuming a bigger and bigger share of every tax dollar collected at the direct expense of everything else the government spends money on. Look, I'm not saying these benefits would go away, but it does mean that something's going to have to change. In order to maintain these funds as they operate today, the government only has a few options, and they're not good, and they may sound eerily familiar to the options my advisor gave me to reach retirement. 1. They can increase the age and other qualification requirements for the programs, kind of like working longer. 2. They could reduce the benefits of the program, a little bit like lowering expectations for your retirement. Or 3, they can increase taxes to increase the amount of money in the funds. Sounds a little bit like saving more, because if you're paying more in taxes today, that's less money going into your retirement plan. Again, I won't say for sure taxes will be higher. However, how many politicians are running on a platform of making Medicaid and Medicare more difficult to qualify for, or by reducing the benefits they offer? So I'll leave you with what option does that leave us with? If you're a corporate America professional and you haven't stress tested your retirement plan against higher future rates or changes to Medicare benefits, let's see where you are at right now. Let's make sure your plan puts you in control to retire when you want, with the lifestyle you want, and surrounded by the people and places you want to be around, regardless of what the government does or doesn't do. DM me and we can schedule a free review of your portfolio to see how potential changes to Medicare or Medicaid might impact what retirement would look like for you.